what is the screening process? So from the age of 17 to 18, we really have to do the breast self-examination. That means that we have to understand, and I'm going to walk you through how to do the breast self-exam. We have to understand the look and feel of our breast to detect any abnormalities. Basically, like for example, how do I know how many white strands of hair I have? Because I am observing. In the same way, we have to be very vigilant about the look and feel of our breast. Now, that goes as the self breast exam. But then, what is the standard? The standard says that we can go for mammogram after the age of 40. That means from the age of, like when I turned 40, doctor, gynecologist told me you have to go for mammogram. I started to go for mammogram. Like it is my choice from the age of 45 to 54 every year, and 55 and above every 2 years. But then what happens to the younger population? And even when we have mammogram is once a year. But then a lot of women, they told me that they had their mammogram and they were so relaxed and relieved that they don't have to worry. But then they felt a lump eventually in 6 months. So what I'm trying to say is that for the population, younger population or the older population, we have to do the breast self exam every month. And then we also have to go for a physical. That means we go to the doctor and the doctor does our clinical breast exam, which is very significant and important because this helps to detect many lumps. Now, saying that, when I'm talking about the developing countries, and I told many doctors in India, so many gynecologists who are women, they told me that this is the reaction. Why are you touching my breast? Nothing is wrong in my breast. I came for a situation in my reproductive organ. And the male doctors told me that it's very difficult to examine a woman's breast when they have come for some other concern. So that means that there is a cultural stigma over there. And my point is that we cannot complain all the time and we cannot break this taboo in one single day, but we have to provide a solution. That's what I'm going to talk about. But before going that, I also want to mention that though the protocol, the standard is that above 40, we have to go for a mammogram. But what happens to the population who are at high risk? That means that they have a family history of breast cancer. So do we ignore them totally, or what do we do? Because mammogram at the age of 40 may be too late for them. So who are at high risk? So that is very important that we understand the genetics of breast cancer and ovarian cancer too. So when in a family, we have breast and ovarian cancer running, for example, the first relative like aunt, mom, grandma, or the cousins, then what we do is we call this as mostly the hereditary breast and ovarian cancer syndrome. And we go for the genetic testing, which we call as the BRCA1 and the BRCA2 mutation testing. Now, when I say that, 5 to 10% of all cancers are inherited. That means 80 to 90% randomly this can happen to anyone. So it's not that, if I'm not having anyone in the family, I shouldn't worry. I should be concerned at all conditions. Now, when I'm thinking about the genetic mutation, the problem that I see is we are always thinking about the females. But we cannot forget the males, because the father can also be the carrier, or they may be expressing the genetic mutation of BRCA1 or BRCA2. And this can be carried to like 50% chances to the son, or it can affect the daughter also. So it's very important that if you know anyone having a family history, we should always recognize the man also equally as we recognize the daughter. We should also recognize the son to go for the testing, because that boy may not only be susceptible to breast cancer, but also to prostate cancer, pancreatic cancer, and other types of cancers too, because they have the promoter now to develop cancer in all these organs.